Good evening, my lovely, and welcome to the dentist. So tonight I'm going to be doing a comprehensive dental exam on you, checking your teeth, maybe keeping them clean, and just, doing an in-depth checkup. So before we begin, I'm just going to do a quick medical questionnaire of such, and then we'll get right into the checkup. So let's just start by asking your name, please. And how's that spelled? Excellent, okay. Now, what about your date of birth? Excellent, and the first line of your address? And your postal code? Excellent. Okay. Right, let's just go through the questions quickly. Bear with me a moment. So, can you tell me what's brought you in today? Do you have pain? Any ongoing worries, concerns with your teeth or gums? Okay, tell me a bit more about that, please. Okay, I see. And if you were to rate your pain on a scale of 1 to 10, 1 being the least pain and 10 being the worst, where would you rate it? Oh, okay. Right, that does sound quite sore, doesn't it? Okay. And what about your gums? Any swelling, redness, tenderness that you've noticed? Okay. What about any teeth sensitivity to cold and hot food as such? Okay, I see. Now, please answer these questions truthfully, as we can tell. So do you smoke, vape, or use e-cigarettes, as this can severely impact your dental hygiene? Okay. And what about use of drugs and alcohol? If you were drinking, would it be occasionally, frequently, daily, rarely, or just like at an event as such, very rarely? Okay. Excellent. Now, tell me about your dental habits. Flossing, do you do that? Do you do that? No, okay. Teeth brushing twice daily, I hope, for 2 minutes. Right, okay. Yes, once a day just isn't quite enough, but don't worry, later on I will teach you full in-depth of how to brush your teeth professionally as such, and flossing too. Yes. Okay, well, I'm going to pop on my gloves and we'll get your chair back. Make sure you're nice and comfortable. Sometimes these gloves just never want to go on your hand. Okay. Now, I'm going to set you back and then I'm going to offer you some gloves and stuff too for your own safety and hygiene, if that's okay. Excellent. Right, bear with me a moment whilst I come and adjust your chair. Right. tie my hair back so it's not falling in your face, and then we'll begin. Right, hair back like I said. Pop my mask on too. Right, now, oh dear, it's not going to work clearly, so we should just take our glasses off. Now, I've got you a pair of gloves right here, if that's okay. Now, just pop them on. There you go, that's one pair. And here's the other. Perfect. That's okay. Now, before we begin, do you need to rinse your mouth out? Are you comfortable? You are? Perfect. That's what we like to hear. Okay, well then, in that case, I'll grab your sunglasses. Right, fashionable, stylish, and practical. So let's just pop them on. Excellent. Okay. Right. Right, I'm just going to have a look in your mouth to begin with, okay? Open wide and say ah. Just checking all your teeth. So we're going to start at the front with your central incisors. Now, to move on to the lateral incisors. And then your cuspids. Your first bicuspids at the back there. Second bicuspids. And the last three would be your first molar, the second molar, and third molar, okay? Just checking them all. There should be 16 teeth on the top and 16 on the bottom. So far, I've counted 10, then 11 would be cuspid again, 12 would be your first bicuspid, 13 would be your second bicuspid, 14 would be your first molar, and 15 would be your second molar, and 16 would be your third molar. I'm not seeing anything on the top so far that looks painful, uncomfortable, or that it's requiring any treatment, so that is excellent. But let me grab my mirror and we'll have a further look. Right, just going to look through my mirror. Needs a bit of tightening up. Right, just some teeth, starting with your central incisors again. And then we're moving on to your lateral incisors, your cuspids, your first bicuspid, your second bicuspid, first molar right and in the back there, second molar and your third molar. And again, tooth number 24 would be another central incisor. Tooth number 23 would be a lateral incisor. 22 would be a cuspid. 21 would be a first bicuspid. 20 would be a second bicuspid. 19 first molar. 18 second molar. And 17 third molar. Now, as I said, I've had a look again, and I can't see any cavities or anything that needs filling, so that is great news for you. But I did say we'd give them a quick clean, and I would show you how to clean. So, just mix up some of my cleaning. Now, so all I'm going to do is squeeze a little bit of this on each tooth and spread it out. Okay, so starting at the front. Just gently cleaning the teeth. Now try not to lick your teeth or swallow or eat any food for the next 3 or so hours, okay? Just to let this have its full effect. Should leave a lovely shiny coating on all your teeth, okay? Wonderful. Whilst I've got you here, I'm going to show you my teeth model, okay? And I'm going to teach you the correct way to brush. So, let's see here. I'm looking over this teeth right up. So, most people think to brush your teeth, you're going to go like this. That is absolutely incorrect, because that's going to scratch and rub off any enamel and protective coating we have on our teeth, okay? So instead, you want to take your brush and you just want to go gently in circles, okay? Like so. Then going around the back, still going in circles. Try to aim at a 45-degree angle to get up into the gums. And then again for the bottom, 45-degree angle, okay? And the other side, circles. And aim to do this for around 2 minutes. Get right to the back if you can. I know it's very hard to reach here because of the skin that actually covers. But please try your best, okay? Now we open our mouth. And again, do not do this. Most people tend to do. circles, gentle little circles. Get in between the teeth and the gaps and the crevices. And again, same thing at the front, little circles. So that is how I would recommend you brush your teeth. Now, for flossing, unfortunately, I ran out of floss. I completely forgot to get more, so that's going to have to be a night of no flossing. But yeah, go right up into the gum as far as you can go, pulling back and forth with your floss. Then pull it straight down to pull any gunk in between the teeth. Now it can be quite difficult to get the far back teeth, but go as far back as you can. Okay, I promise it's worth it, okay? So, I'm going to take your sunglasses from me. Perfect, thank you very much. And if you want, you can take your gloves off. To the side of you, there's some water if you want to rinse your mouth out, okay? Right, and I can take your gloves too, thank you. Right, well, I think your teeth are looking absolutely wonderful. Now, as I said, just no eating or trying to make your teeth for the next 3 hours. They're looking lovely and straight. I don't see any need for orthodontic referral. I don't see any need for a proper descale. Just that little clean should be enough. But as I said, brush twice a day. And if you do have any ongoing pains or anything, do not hesitate to get in touch, okay? I'll be more than happy to assist you. Well, let's just get your chair back up and you're free to go. Right, well, thank you for coming to the dentist tonight. It's been wonderful to see you. And I look forward to seeing you again. Good night, my love.